Hello everyone, I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today I'll talk about what are the reasons of infertility or inability to conceive in polycystic ovaries. Polycystic ovary is very common condition nowadays because of multiple things. What we consider the reasons for polycystic ovary can be genetic, can be inflammatory, and also lifestyle associated. So once you've been diagnosed with polycystic ovaries, it is difficult to get rid of the condition, and I want to emphasize that most of the patients waste time in thinking that they will cure their polycystic ovaries before planning pregnancy. So your pregnancy planning should go hand in hand along with your polycystic ovary treatment. Most of the times what happens in PCOD is because of the hormonal imbalance, the eggs which are developing in the ovary, they do not undergo full maturation and release from the ovary. So they accumulate or they get stuck in the ovary and give an appearance which what we call as pearl string appearance or polycystic appearance. Poly means multiple, cyst means fluid filled spaces. Polycystic appearance on ultrasound. So on ultrasound, if I'm seeing more than 20 follicles in each ovary, then we consider it as ultrasound criteria for diagnosing PCOD. But there are other criteria for diagnosing PCOD like having symptoms, irregular cycles, having facial hair, what we call hirsutism, or having hair on your chest area or abdomen which are thick and coarse. Also having irregular cycle, which is also an important sign of PCOS. So PCOS, because of the ovulation problem, the egg being not released from the ovary, there might be problems of conceiving. Normally how you become pregnant is after the cycle of ovulation is over, the egg after being released is picked up by the fallopian tube. When you meet, the sperms fall in the vagina and the sperms travel inside the uterus through the tube to reach the egg in the tube. So in PCO, if the egg is not being released, there is no fertilization possible in the body. So the pregnancy does not occur. Other reasons in PCO for not to conceive is the egg quality can be compromised. There might be other conditions associated with PCOD like having insulin resistance, sometimes even resulting into actual diabetes mellitus requiring treatment for controlling blood sugar, can affect your egg quality and your embryo quality. Other conditions like thyroid is also associated with PCO. There are some PCODs where we see metabolic syndrome, which means there might be other systems which are involved like having high blood pressure, having high blood sugar, or having high cholesterol levels. Such patients require treatment for their general health to control all these conditions. And all these conditions can affect your egg quality and embryo quality. Also, polycystic ovary patients sometimes have higher side weight. So your BMI, which is more than 25, can also affect your chances of pregnancy. Especially BMI above 30 is considered to be a cause for implantation failure even in IVF. So somebody who has high BMI, weight on the higher side, we advise them for weight reduction before embryo transfer. So these are multiple reasons why PCO patients have problem in conceiving. Also, after conceiving, the polycystic ovary patients have higher chances of miscarriage because of the egg quality. And so if you have polycystic ovaries, please consider visiting a fertility specialist for proper guidance on the condition and conceiving early, because when you conceive in younger age, the chances of continuation of pregnancy and having a healthy baby are maximum. If you wait too long beyond 35 years of age, then the chances of pregnancy also fall because of the age and chances of miscarriage also increase. I hope this was helpful. Thank you.